Okay, so hello everyone. A very good morning to all our attendees. This is Dr. Shikha Sharma, and I am going to be the host for today's webinar. And the topic on what we are going to discuss is pregnancy and oral health. And our guest speaker is Dr. Madhvi Barai, and I give a very warm welcome to her on DentistChannel.Online. We are very, very happy and proud to have you on board with us. Before proceeding further, Doctor, I just wanted like a intro about you to all our participants. Dr. Madhvi Barai is a well-known cosmetic dental surgeon. She is uh, she just completed her graduation from Bharati Vidyapit Dental College, Pune in 2013, and she did a lot of healthcare campaigns. And then she worked with endodontists and orthodontists and gained a very valuable experience there. And in 2017, she did a fellowship program. That's where she achieved a certified forensic odontologist. And in 2019, she opened dental studio, which is known as Avdesh Dental Studio. And she did 15 plus certifications in cosmetic dentistry till now, which is a very proud moment, Doctor. And she launched her magazine also, which is known as Toothpick. Regarding all her achievements, she also is a certified yoga trainer, and she knows many languages like Hindi, English, Gujarati, Marathi, Arabic, and French as well. Welcome, Doctor.
Thank you, Shikha. This is great introduction.
So before we start our webinar, I just want to inform our attendees that if you have any queries or any questions in between the webinar, you can put that in a Q&A section, not in the chat box, and all your questions will be answered by Dr. Madhvi by the end of this webinar. So without further ado, let's start this webinar. All over to you, Doctor.
Thank you. Just a minute. Yeah. Can I share my screen first and then we'll just go ahead?
Yes.
So thank you so much, Dr. Shikha, for this warm introduction, for the warm welcome. It's really a pleasure and it is my honor to be here and to share pregnancy and oral health care. So what happens usually, pregnancy when associated with oral health care, dentists are scared. Forget the patients being scared, the patients are scared, of course, that's their part to do. But what is unfair is when the dentists are scared to treat pregnancy or oral health care which is related to pregnancy. When it comes to care, people are not as much as scared, care ke liye they will pitch in. But when there's a problem, they'll be like, no, I don't think we can treat you. And that's really unfair, because logically everybody deserves medical or dental care at any point of time, be it a pregnancy case or be it any situation wherein the patient is paralyzed, not able to walk. In any given situation, we have to know our bit the best, right? So today I will take this opportunity to introduce you to pregnancy and oral health care, and through this I will walk you through areas wherein you will guide your patient before the pregnancy, during pregnancy, after the pregnancy, even if they are planning it, and what to be said, what to be told, and what to be taken care of. Now, this is a short note which summarizes pretty much the whole webinar today, because that is importance of oral health and various treatment modalities to pregnancy. Now, little did we know, that pregnancy, bad oral health during pregnancy affects the overall health of the mother, first of all, and affects the overall health of the baby, because the bacteria that develop during this time, the enhanced growth, they travel through the bloodstream through the placenta to the baby. It is a well-researched topic. It is not something that came up yesterday and we are talking about it tomorrow. if these bacteria are kept in proper growth, or I mean proper vigilance, or how the growth is, how well your oral flora is, you might be able to take care of certain issues like preterm birth, issues of baby weight during pregnancy, and these are such little things that can be looked into so easily, and the outcome is really huge. There are a lot of women who have bad oral health and they give birth to a baby which is underweight. Now they blame it on so many things. They blame it on nutrition, they blame it on hormones, they blame it on genes, they blame it on so many macro micro levels, but they will not know that it is merely because of oral health. And trust me when I say this, once your oral health is treated before or during pregnancy, your baby is much healthier, and there are studies that say so. Right? So did we know that overall oral health of the mother can affect the baby? I also have a magazine that will talk about it later as we come to the end of this webinar, and how that is also help there. Now, the first topic is pregnancy and oral health care in general, before, during, and after pregnancy. Now, before pregnancy, if you have a patient who is your regular, appointed patient, and you know that they are planning pregnancy, install or instill in them the idea that oral health care should be paid attention to before they plan it. Right? This is the right and the safest phase to plan, before you plan your pregnancy, to plan your dental appointment. Now, in this dental appointment, usually what do? We make sure that whatever bacterial load the mouth has, the gums have, or the teeth have, has been brought down to certain extent that does not affect later on when the hormones go up and down. Right? When we talk about hormones, pregnancy controlling pills, both of them, they cause hormonal changes in your body, which is basically rise in the progesterone level. This progesterone level then gives food, or actually enhances prostaglandins. Prostaglandins, they make sure that the gums grow in size. You will have gum problems. Once the gum problems start, plaque accumulation, calculus formation, cavity formation, so much to go about, right? While pregnant. Now you have a patient who has come to you. This is the place where we get scared, not the patient. That the patient is pregnant. You get the patient seated on the chair, you're taking their history, and you ask them, are you pregnant or not? And they say, yes doctor, I'm 2 months pregnant. And you will just be like, acha theek hai, checkup karke inko bhej dete. But that's not fair. During pregnancy also, there are a lot of treatments that you can do, starting with the safest of all, that is cleaning. Reduce the bacterial load, do a proper oral prophylaxis, do a proper polishing, use fluoridated toothpaste, prescribe fluoridated toothpaste, soft bristle brush, mouthwashes which are non-alcoholic. So this is everything that we start dental care while pregnant, because at this phase we are just not looking at one person, we are looking at two. So that's why I said that it's always a healthy smile or a healthy start for two. Right? Like I said, if the mother's mouth is healthy, the child is going to be healthy and the baby will be healthy. It does not affect the baby in any way if you do dental treatment during pregnancy. I have done treatments like root canals during pregnancy with no or minimal x-rays. I'll talk about x-rays also, because we have a myth attached to us that x-rays are harmful for the baby during pregnancy or whatever, right? Now, the common question, how does mother's oral health affect the baby's health? Does it affect the baby in the womb? Does poor oral hygiene make pregnancy complicated? And so many questions that the mother or the doctor or the dentist, the relatives come up with popping in their head. The answer to this is that yes, every bit of bacterial load present in your oral cavity affects the baby in the womb. It, like I said, there are studies which show that poor gum disease during pregnancy is linked to low birth weight of the babies, or preterm delivery, premature delivery, whatever. If you give preventive oral health care during or before pregnancy, there are higher chances that the baby's mouth will be healthy and the health will be healthy. I mean, it'll be a healthy baby. What are the dental treatments? Like I spoke about, highly recommended for expectant moms is, gum therapy, scaling, gum therapy and scaling are so much less paid attention to that we just think that it's something very normal, nahi kiya to bhi chalega, but no. Reduce the bacterial load there. I keep saying this again and again because that is the culprit. It's not being pregnant or it's not the hormones, it's the bacterial overload which gets food from the hormonal fluctuations. Right? So reduce that. If there is any cavity that needs to be filled, do it right away. Like I said, see, this is a patient that I work with, and she was 9 months pregnant, and she came with a swelling which was as huge as her nose. So she was like, "Hey, doctor, I've been dealing with this since 2 months, but now I cannot bear with the baby also, and I cannot bear with this swelling also." And I'm surprised that for 2 months she did not consult a dentist or she did not tell anybody, and anybody in the house would be like, "This is all right, no problem." They are so much focused on just the baby popping out than why the swelling is there or what is going wrong here. So yeah, and during pregnancy there are so many things that are considered to be unsafe, and that's why we call them myths. First of all, people think that local anesthesia is unsafe, the normal people, but dentists also think because they are not aware of it. And trust me, there is a certain dose that you can administer local anesthesia in, and it is safe for the baby. There are no side effects, or there are no ill effects. When it comes to x-rays, high radiation x-rays are not allowed, but the x-rays, the IOPs that we take at lower radiations, like we take for kids or anyone, there are certain settings that you can do in your source, and a lead apron, of course, a thyroid collar, all of that mandatory. You can take x-rays which are called your chair side x-rays, which is for the you can plan that out. See, when I did a root canal, I took my final x-ray while my master cone was placed, and I had to do it. There was no option in there, so I took only one x-ray or maybe two to complete the whole procedure. I might not take any x-ray if just a filling is required. Having said that, coming to after you have had your baby, now there are certain adamant patients, even though they are going through pain, they'll take plain paracetamol for 4 months straight, and they'll be like, after the baby is born, we'll do the dental treatment. Encourage them. Don't be unsupportive there. Even after they have the baby, they can approach us for the dental treatment, and they should, because they have faced the problem during their pregnancy. Now, what happens? Nature is magic. Once the baby pops out, the hormonal levels go so down that all the dental problems that at one point were flared up will come down. And the patient will think, oh, it was just the baby that was causing harm in my oral cavity. It's vice versa, that the oral cavity was causing problem to the baby. Having said that, the baby is born, but the oral cavity still remains loaded with that much amount of bacteria, still, even more maybe, because once the mother is admitted in the hospital, 2 3 days they do not follow any oral hygiene, and it of course increases. So after having the baby, it's never too late. You can always take up an appointment as soon as possible. We encourage every female patient that we have in our practice to meet us before they plan the baby, even if accidentally they have gotten into kept a pregnancy, and they know, okay, we have a good news now. Never too late, get it now before your delivery of the baby. Visit the dentist once, and after. So at this point we also guide them on how to take care of an infant's oral mouth after feeding, and that's a whole different topic. We can talk about that someday, but we also give them information on that. A second bit for this is morning sickness and its effect on oral cavity. Everybody knows that during pregnancy women experience acid regurgitation, which is referred to as morning sickness. And everybody thinks it's normal, but it is not normal. So, morning sickness is associated to pregnancy. That is normal, completely understood. And it is something that what happens, your gut gets agitated to certain stimulus. Now, these stimulus could be different in every individual. It could be smell, taste, it could be even certain kind of fragrance, like smell, of course. So these are the stimulus that increase or initiate the acid regurgitation. What happens to the oral cavity once the morning sickness episode is over? Though, again, the funny part is it is called morning sickness, but it is not associated just to the morning. It is occasional vomiting that happens throughout the day, which starts in the morning because that's the time when your mouth has been closed, your oral cavity was closed, say for 6 to 8 hours of your sleep, or maybe less. And when you wake up, the oral flora has grown so much, or build up so much that while the morning sickness episodes start to kick in, you are so unaware that what went wrong and why is it happening. There are so frequent vomiting episodes that happen in the morning, which lessens throughout the day. What happens to the teeth and the gums? We have altered taste throughout the day because of the acid reflux. Dry mouth, again, because the acid reflux causes a lot of dryness in the mouth. You will suddenly start to feel that you need a lot of plenty of water, feeling dehydrated. The tooth decay starts irrespective of whether the decay was already there or not, because the enamel starts to erode. Once the enamel starts to erode, your food gets attached or stuck to the tooth quite frequently. Ulcers is something very common during pregnancy. There are a lot of reasons. One is associated to morning sickness. Second, again, like hormonal changes and many more. Now, what to do about morning sickness? It is very common in pregnancy, like I said, because of certain regurgitation. When the baby is in the womb, the sphincter that closes on certain stimulus does not close, and that is one reason that this happens. The other reason is at this point of time, all the muscles are relaxed in a relaxed situation, and that's why the sphincter is also relaxed. What to do is first is prevention. We'll talk about remedies, we'll also talk about treatment. So in prevention, like I said, avoid the stimulus, whatever the stimulus is. It could be smells, scents, some certain kind of food. We also, since you feel dehydrated, we tell the patient to avoid heat or avoid hot also, to go out during the hot places, avoid claustrophobic places. They also initiate, nausea. Keeping oneself hydrated is best. This actually applies from before you're pregnant or after you're pregnant, and drinking water is something so much overlooked upon. While pregnant, try consuming water, lemonade, all these substitutes to water, because people, I mean women, they do not even like the taste of water, right? They can also try frozen fruits, milk-based products. Again, know your gut properly. If milk is your stimulus, it's the sensitive part, avoid milk. If milk is something that soothes your gut, then you can do that. And that applies to anything. Some people, some of them are sensitive to lemon, so they will have to avoid that. And some cherish the taste of lemon. So yeah, remedies. What to do? What to morning sickness हो रही है, but after effect, the aftermath should not affect you. उसके लिए what can be done? Try vitamin B6. So vitamin B6 is water soluble and it is found in many foods. And during vomiting, what happens? We lose most of the electrolytes from our body. So keeping oneself hydrated with water and other hydrating solutions is must. But B6 is something that helps your healing of the gut, the scratching that happens because of vigorous vomiting. Ginger, it is actually proved to reduce nausea, and it helps very well. Vitamin C, ginger tea, frozen fruity popsicles. What to avoid is greasy food. Some of them are very happy when they eat bland food, something that does not have a certain kind of smell or taste. This could include a lot of things. And like I said, avoid hot and cold foods together. They can agitate your gut very easily. Eat in smaller portions and eat very frequently. So what happens, even if you throw up or even if the nausea kicks in, but you have not vomited it out, the the food gets time to settle if it's in little portions, right? One thing I think I've not mentioned here is, if your patient complains to you on phone or in your OPD that I have a lot of morning sickness, tell them to avoid brushing immediately after the episode of vomiting. Now, what happens, most of us, most of them, they have this idea that vomiting hua, the taste of my mouth has altered severely. I need to brush or I need to use a mouthwash. In the first 30 minutes, they can only gargle with normal water, tap water or drinking water they can choose, because the acidic level in your mouth is so high that when you start brushing, you're rubbing the acid against your teeth. And this is causing more enamel erosion than the acid itself present in the mouth. So only thing that you should advise them is to do a normal water gargle, and after 30 minutes of the episode, either brush with fluoride paste or use a non-alcohol fluoridated mouthwash. This will give time for the pH to fall down, for the acid levels to fall down, and then you can put in your fluoridated toothpaste or brushing forces and mouthwash effects. They will then get the pH much lower. But immediately after the episode, it is highly not recommended to start brushing or do brushing or even use mouthwash, right? It is going to erode the enamel. Treatment, in most cases, the morning sickness disappears over time, but what we have to promote is prevention. So prevent morning sickness, because we know it happens, but you will have to figure that out what the stimulus is, because this acid is affecting your teeth. In no matter what you say, even if you say कि एक ही उल्टी हो रही है पूरे दिन में, it's okay. Try to avoid it. Try smelling a sense that reduce the feeling of nausea. Right, in extreme cases, if the patient is feeling dehydrated, दिन में एक नहीं but 10-12 उल्टी हो रही है, she is weak and she might have to consult their physician and take that taken care of, because then that's going to leave her to weaknesses. Dental tips for morning sickness. Yeah, I think I forgot that I had added it here. This is all I mentioned, that don't brush immediately after the reflex, wait for 30 minutes. And I have heard this, that brushing triggers nausea. So they don't brush for good, say 4-5 months. And even if they brush, they'll brush with their finger. No, that's not a good idea. There are pastes or there are ways available wherein you don't have to touch your palate or certain areas in your oral cavity that are sensitive, that actually initiate the reflux. So you can talk to your dentist about it, that while brushing this happens, and they will find that spot for you which is causing the vomiting or the nausea episode, right? Like mouthwash also triggers nausea. So there are ways, there are substitutes to it. One among them being that you can mix 1 teaspoon of baking soda to 1 cup of water. The reason here is it's not the magic of baking soda or anything else. It's just that it's so bland. Second of all, the effervescence helps the patient relieve from the acidic characteristic in the mouth. Third, it has no taste or no smell, so patient feels happy about it. Chewing antacids is safe in pregnancy. There is no problem there. You can chew antacids that will reduce the pH of the mouth immediately. You can also, if they are not comfortable chewing antacid, we can give them or subscribe them syrups, right? Drink plenty of water, like I said, because vomiting dehydrates you. Consult your dentist if at all. Like the patient has to know this, they have to consult their dentist if at all anything goes to the extremes, right? Know how to treat or provide dental care during pregnancy is the main agenda of this webinar, and even is what I feel that we should know in our practice. The very minor stipulations or manipulations you need to do than regular dental care. One is the chair position. Make sure once you know that the patient is pregnant, keep them in upright position. Practice standing dentistry. Get out of your comfort zone to give them the comfort. So in standing dentistry, what happens when you are standing, the dentist is standing, the patient is always in the upright position. You cannot recline them or put them into the supine position. Second of all, even if you're not planning to take any x-rays or planning to give radiation, be safe with a lead apron. That will give your operatory. My operatory is such that there are 2 or 3 patients I can take at a time, and I advise everybody to not take dental x-rays during the treatment. Try to give them a secular appointment wherein you can listen to them, because it is just not dental treatment, it is psychological therapy also that goes on here, that the patient talks out their issues to you and they feel a certain discomfort if there's someone around, right? Talk about their relatives, talk to their relatives and give them the guidance that how important it is to take care of oral health. Don't overlook it, and ask them also not to overlook it. Yeah, so these are very little good points. Something that I see often is pregnancy tumor when it comes to pregnant patient. They walk to you because of this, because they get scared. They are like, why is this lump growing and what happened suddenly? And there's so much to take care of, during pregnancy. The baby is coming, the family is excited, and the mother is worried about this. Now, what is this? It's called a pregnancy tumor. The name is scary. It is called a tumor because one, it is of overgrowth. Two, it is not harmful, it is not painful, but it is bothering. It bleeds on slight touch. These are the characteristics. We'll talk about it later, but this is how it looks. This is from my own one of my patients. She came in with this. I think she was 6 months pregnant. And you can already see in this picture there's so much plaque formation, calculus deposit, and she had actually come for pain in the lower molar. I saw this and I'm like, what is this? And she's like, I am okay with this. You don't touch this. It will go once the baby comes. I said, who told you? She's like, my dadi told me that this is normal. I also got it. Your mother also had it. So you are, so it's not a blessing. You have to take care of this. This is going to cause harm to your baby. So yeah, people now understand. All the patients, they're very understanding that way. They learn from Google also and come. So why not you teach them a little? So yeah, are pregnant women at greater risk of periodontal disease? And the answer is yes. We know the reasons why. Fluctuation of hormones, already present oral flora, and old fillings, bad treatments done, so much. Right? All of this adds up. Now, why only the gums get inflamed? Do you see the inflammation elsewhere? Yes, we do see it elsewhere, but we cannot see it with our naked eye. Now, gums is something that you can see. The other inflammations that happen is, of course, and that's the reason that you see morning sickness, because there are tissues, there are areas in your gut that are inflamed. We're not talking about that. We'll talk about periodontal disease first, that why the gums get inflamed. Like I said in the beginning of the lecture, that the progesterone levels are high, which enhances the release of prostaglandins, and that increases the vascularity of these areas. One amongst them being the gums. Now, in gums, already there is gingivitis. The patient has periodontitis, and once the supply is increased, the growth starts. Now, this growth is seen like a lump-like growth. Seen in the studies say that it is seen in 5% of pregnant women. I have seen it in almost every patient. And this, like I said, the term is scary, but it's benign, non-cancerous overgrowth. Talk the patient through it. There's surgical approach required only if it's very severe. Otherwise, a mild approach is enough. Even if you do localized scaling, the patient is not ready to get a complete scaling done. I try, and they never say no because it's for their benefit, but try for a localized scaling. Utne se area mein apply local anesthesia jelly or spray and do deep scaling. You will find chunks of calculus coming out of that area. Even if not, it's going to bleed the minute you touch. Let it bleed, and it will be gone by 2 days. There is no, patients avoid brushing also in this area because it bleeds on mere touch. Talk to them that poor oral hygiene is the reason that this happened, and inadequate or improper or inefficient brushing is not going to help. How does it look? It looks like strawberry. Because it's red, it has prick points from wherever it's bleeded, and it is common always in the interdental papilla. How can it be prevented? Like I said, during the planning phase, make sure that there is this. Tell the patient that this is the future picture. If you don't get your oral hygiene looked upon before you plan your pregnancy or even during, right? हो ना हो अलग बात है, but अगर हो गया तो that will be very difficult to control. Then implement a healthy oral hygiene. Explain every patient in your practice, not pregnant, anybody, to brush twice daily. Make it mandatory for them that you have to, there's no option. Fluoride toothpaste, introduce that to them. Depending on every patient, you can introduce whatever suits them the best, but fluoride for pregnancy. Soft bristle toothbrush, light brushing forces, proper brushing technique, non-alcoholic mouthwash 4 to 5 times a day. Explain them the routine like this, that after 30 minutes they can do it. Limit to sugary and sticky food and eat through regular intervals. What is the treatment? One, I said under local anesthesia, jelly or gel, not the injection per se. but you can do a proper deep cleaning, root planning, or scaling, non-surgical periodontal therapy. You can also administer local anesthesia. It is absolutely safe for the baby and the mother, right? In needed, like I said, in severe cases, if it's really bothering, there are patients who are sleeping and there is bleeding constantly that happens, that stains their sheets, and it's very horrifying to them. You can do that surgical removal. It's pretty easy. Healing is good. No complications needed. No follow-ups. You might not need, because they are not very easy with follow-ups. They have their own mood swings and it's bad. Now the myths. I'm sure by the end, this is almost the end of this webinar. We're nearing it. But by now, I've already busted a few myths, and bust them to your patients also. Let them also know that this was a myth. It is the granny story and it is not the real story. So I will read them out to you here because I have jotted them that way. One is oral health of the mother does not affect the baby, and we know it does, right? Morning sickness is not any fun but doesn't do actual harm. It does harm your oral cavity. It's okay to stop brushing teeth during pregnancy in case of gagging. No, it is not. You have to practice proper oral hygiene. And if brushing is causing gagging, meet your dentist. Find out that spot for you. Find out a substitute, a better electric brush, or there's so many things that we can introduce in one. It's okay for pregnant women to ignore bleeding gums. Wrong. You do not have to ignore them, you have to address them. X-ray should be avoided during pregnancy. Let the doctor decide for you if needed. It's not going to do no harm to you, provided your source is a certified source and the radiations are minimal. It is better to brush teeth immediately after vomiting. No, avoid brushing immediately after vomiting. Wait for 30 minutes and then start with a mouthwash or brush very gently. If a woman is pregnant, she can skip dental checkups. No, you should, or you should encourage every other patient and educate them that dental checkups are important. Local anesthetics affect the baby negatively. No, they do not affect the baby at all. Right? Suggestion and dental care tips for pregnant women. These are in general, like any one that walks into your practice, guide them through this, make a protocol for them. So for them to have a better hygiene practice, right? Like I said, before conceiving and during pregnancy, you should take several steps to make sure that the oral health is best. Brushing twice daily, fluoride toothpaste, non-alcoholic mouthwash, flossing. Introduce them to electronic dental flosser. It is going to do wonders, right? Healthy and nutritious diet, know your gut. If it's initiating certain kind of irritation, avoid that kind of food, right? Make an appointment to see the dentist first trimester, second trimester, and then maybe you might not need it. But once the baby is born, you should see the dentist again, right? This is one thing that I tell my patients during the treatment also, that if they feel uncomfortable table, they can get up, take a walk, sit in a certain position that makes them comfortable, and I get comforted. I get a, you know, I try to manage according to that. There was this one patient who would only sit with her head turning towards right. She could not sit straight or turning towards left. So I had to manage that, and that's how we do, right, with kids and everybody. So ask them their comfortable position, and at home also tell them to use pillows, take proper rests, right? Fibrous protein diet. Explain them that there is a connection between your oral health and the birth of the baby or the baby in the womb, and they'll completely take it seriously because the baby's health is their priority, right? Stay connected with the patient and ask your patient to stay connected with you. Be very easily accessible to them, because there'll be simple doubts they'll have, that doctor, I have a craving of doing this, can I do it? And all they want to hear is the a proper guidance to yes or a no. And of course you can talk them through that, if it's healthy for them, not healthy for them, if it's going to benefit them in any such way, right? Like I was talking about, we have this magazine that I have launched, which is under the name Toothpick. And the first issue that I addressed in this is oral healthcare and pregnancy. I have written 5 articles in this. I've pretty much shown you a gist of that in this webinar. And this magazine is because I want to make it oral healthcare an integral part of everybody's life. So first is oral healthcare and pregnancy, because what better than a pregnant lady who is already taking care of her and the baby. The second is on 0 to 2 years, oral healthcare for 0 to 2 years, because like I said, the parents are not aware that an infant's mouth also needs cleaning and how. So this is my little approach to educate the society, because it is, I feel it's my responsibility as a dentist, and I encourage all of you to do the same, that do your bit, try to spread your bit, and the dental awareness that you can spread amongst your circle, and educate them in the right direction. Anybody who needs the copies to this, you can mail me or put in your email address ID. I can send you the physical copies. There's also QR code, you can access to the digital copy, and it's free of cost. You can give it to all your patients or pregnant patients and keep it in your practice at the reading corner, and patients will read it. If not, so you can encourage them to read it, and it's going to be of great benefit. One, it is free of cost. Two, it's a biannual magazine. There are two issues that we'll release every year. The second is coming out in July, and three, it is in two languages, because I am practicing here in Gujarat. I chose it in English and Gujarati on the same page. So the inside of it is very colorful, and something that people love reading. So it's like into, sorry, yeah. So if one side is English, the other side shows Gujarati. So I'm sure this will be of a great help and an uh, added aid in your practice. And thank you so much. I'm sure this will help you cater almost all pregnant women. Don't get scared. Let them walk into your office, feel comfortable. Make sure they see you again, because that will benefit both of you. Thank you. If there are any questions, Dr. Shikha, that you need me to answer, I shall.
Yes, Dr. Madhvi, that was a very engaging presentation. I
Thank you. I hope it was
loved it.
clear and nice. And if there are
Yeah,
any doubts, apart from what I spoke, or again, if there's something anybody wants me to repeat on, I can.
I think you have cleared all our doubts. That's why I can't see any query.
Is this normal?
Yeah,
Yeah,
absolutely. Okay,
great. Then.
I want to ask you something that if during a pregnancy tumor, can it be treated at any time of the pregnancy?
Yes, it can be treated at any time of the pregnancy, and it actually occurs in very randomly. It will occur usually during the end of second trimester, is what the research says. But I have seen that patients report to us at various times. It can be treated at any point in time. Seventh month, eighth month, ninth month, does not matter. Depending on how comfortable the patient is, you can choose to give a long appointment or a short appointment. So if you choose a short, do localized scaling in that area. And if the patient is comfortable for a longer appointment, do complete oral prophylaxis. See, this is also a pregnancy tumor, but the position is very absurd. I'll show you. See, this is also a pregnancy tumor. This is not an interdental papilla. It is not a strawberry-like growth, and yet it is still a pregnancy tumor. So this was not endo-related. We thought it is endo-related, but it was completely a perio growth. So we
It's
did
the
localized scaling.
early
Sorry.
stage of pregnancy tumor.
Yeah, correct. So this actually, in some patients, they tell us yesterday there was nothing and today we have this huge growth. So that is just their view. It never comes overnight. It grows, little by
Slowly.
little, and they only see it when it's the size of a nose. I always tell this, that naak jitna bada ho gaya tab tak where were you? But we cannot blame them, because there is so much to be taken care of by them.
Yes, absolutely.
This
So,
was very beautiful, so I actually clicked it for my magazine only. Like, it was proper
uh,
strawberry shape. Maybe the photo does not do great justice, but you can see prick points all over,
yeah.
and it
It is
it was
almost a triangular shaped growth.
correct. Yeah, this is what it will look like normally, and this is the best site also,
All
the
right.
commonest site. it will be between the second and the third, like lateral and canine. Yeah.
Okay. I think I would like to have one copy of your magazine.
Definitely. So what you will do is, if you want a digital copy, you will send me your link. If you want a physical copy, I'll send you 5 physical copies. You can drop in your address.
All right. So I would like to present a small presentation. Doctor, can you please just stop sharing your screen?
Yeah, sure, I'll do that. Just give me a minute, okay, Shikha?
Okay.
I'll take a picture here for my reference. Yeah. Okay. Yeah. Done.
Okay. So I would like to present a small PPT about our channel.
Yeah. And thank you again for inviting me here. It was a great
It's
place.
totally a pleasure. Actually, we learned a lot from you.
That's great. I really hope
It's an
that,
honor to have you on board with us.
thank you for being kind.
So yes, I think my screen is visible to all
Yes,
the.
it is.
So yeah, a Dentist Channel Online is India's first digital dental media. It says healthy smiles, wealthy lives. It's like we support dental community. We support all the hardworking dentists, and it's all about creating awareness, spreading dental education, all about latest technology advancements related everything, anything related to dentistry, and all under one roof. So you can find anything, everything related to dentistry here. And this is our website, www.DentistChannel.Online. So this is our services that we provide is like the webinars we conduct, the courses, the events and workshops, everything related to dental news, premium videos, and so on. And you can register and participate so that you can get the certificates. And I would like to say that the Prime membership has huge benefits, like you have to pay a minimum amount and it is applicable for the whole year, and you can get all the benefits throughout the year. And only the Prime membership participants can get the e-certificates after attending any webinar or any workshop. So these are the benefits that you can get. It's a personalized account in DentistChannel.Online with access to profile. They can get special discount on dental courses. Likewise, I just want to tell that you can apply capital double S 100 codes to avail a special discount on our Prime membership. And these are the certification by recognized institution with CPD and CED points. And you can download your certificates from profile anywhere.
Shikha, can I interrupt you? Because the slide is not changing.
Okay.
Yeah.
Can you see that? Is it changing now?
No, it's still on the first slide, and you might have to, move it from the left side.
Okay. Just wait, I'll reshare again. Yeah, is it visible?
This is visible. Now, if you go to the second slide, just check that.
Okay.
Yeah, the second slide is not visible. So you might have
Is it
to just,
visible now?
no, the second is not.
Okay. Okay. I'll just resume
Yeah,
from
now
here.
it's,
Okay.
yeah, second. Now it's on second, but if you go to third, select third. So I think then it'll,
Yeah, I'll do that.
yeah.
Okay.
Now better.
So I was talking about the Prime membership benefits, and you can get a lot of benefits like participate as a speaker, publish public awareness videos to create oral hygiene and oral health to the people around our community. You can access to scientific articles and recorded webinars as well. You can get all the regular updates and news about dentistry. And this is what you get after certificate of participation after you attend the webinar and our workshops. The next slide we have here is the key highlights. We have conducted 700 plus live dental webinars, 25 plus dental workshops, 40K plus participation certificate issued, and 400 plus national and international speakers, 300 plus oral care videos under Save the Tooth. Okay, now I just want to talk about the SaveTheTooth.in campaign that we just started. And here we spread all the dental education, oral health, and how to maintain oral hygiene. We update and upload all the informative videos there. So I think you should check that out also. And next we have is a pride moment in sharing that DentistChannel.Online entered into India Book of Records for having maximum numbers of speakers participating in a virtual conference in oral implantology. So the first virtual dental implant expo was held between 17th and 26th August in 2020. The next happened in 5th November. So many speakers were there and it was a huge success for our channel. It is a reliable, reachable, and responsive media partner. We were the media partner in the dental exhibition, which was held in Dubai and in Istanbul every year. And then we were the media partner in the conference on corticobasal implantology in Jaipur. The next is the Indian Society of Oral Implantologists and the magazine release of Indian Society of Oral Implantologists. So these are the organizations, and this is the media partner. We have been at various different events, which was Quizathon, Dentistry and Oral Health, which held in Berlin, Germany, Implant Symposium at Mumbai, Indian Dental Association Conference in Hyderabad, and so on. And this is where you can find Dentist Channel Online. You can find us on Facebook, Twitter, Instagram, LinkedIn, YouTube, WhatsApp, and Telegram as well. You just need to type Dentist Channel Online on Google and you can reach out to us anytime, anywhere. And I would like to talk about the upcoming webinars we have. The next webinar is going to be on 8th May. The topic will be tips and tricks of DSLR photography. I think that's a very different topic. And Dr. Sumit Arora is going to be a speaker. The next will be diabetes from anesthesia to implant. And then we'll have our webinar on 15th May by Dr. Patricia. The topic will be immediate implant in aesthetic area, how to achieve the best results. And then patient complaints in removable prosthodontics, how to diagnose and manage by Dr. Muhammad Ramadan. And next we have on 21st May, that is easy techniques for shaping and clinical tips for before obturation by Dr. Sara, that she is going to host that. And Dr. Muhammad Salama is going to be our guest speaker. So I think we have come to an end of this webinar. So I really want to thank all of you for joining us. And Dr. Madhvi, I think I'm audible.
Yes, you're audible. I was just giving you the. Thank
Yeah.
you. Congratulations on all these achievements, and it's great platform. It is really well catered and well looked upon, and I hope everybody takes great use of this platform and get benefit out of it. I'm sure it's very helpful, and I would encourage all of you to take part in it, be a
Thank
part of
you.
it.
Thank you so
Yeah.
much. It was very, very honorable to have you on.
Thank you
Uh,
again, Shikha.
Thank you for your
Anytime.
time. Thank you.
Thank you. Thank you for inviting me, and it was really good.
Okay.
Yeah. We will end it here.
Yeah, I think we are going to
Yeah.
end here. Thank you.
Thank you so much. All the best for future.
Yes, thank you so much.
Bye.